Hello, my name is Zaid Neshwat, and I will be introducing our community health project, which is titled Influences of Social Determinants of Health and Influenza Vaccination Rates within Arizona's Community Health Centers. There were several factors that led into us choosing this topic, one of which was just realizing the low vaccination rates within the community health center. In addition, talking to the preceptors and RDMEs and noticing a significantly decreased rate of vaccinations within the Hispanic population, which we will be focusing on in this research paper. Our research objectives are just to recognize the relationship between education and income in regards to influenza vaccination rates of the Hispanic population at Adelante Healthcare in Mesa, Arizona. The main goal is to improve and enhance healthcare delivery to this population and the community based on our findings. Thank you.
Hello, my name is Anthony Mancuso, and I'm going to discuss the methods section and how we conducted our research project. So once we established that we wanted to identify barriers to influenza vaccine, we created a survey that first had patients identify some basic demographic information, which included age range, sex, income level, and education level. After that, they identified whether they had received the vaccination this year and in what form they received it, if they had. In addition, we also had them identify why they got the flu vaccine. This included because the cost was covered, because they wanted to protect themselves, and because it was important to protect themselves. If they had not received the flu vaccine, then we got to the main crux of the survey, which had them identify reasons why they did not get it. And these were identified in literature, as Zaid was talking about, and they included reasons that the flu vaccine would cause them to get the flu, or they had to get the shot every year, or they had to, in fact, receive it as a shot. So this was kind of the basic outline for our survey. We collected surveys from December 1st, 2014 to May 30th, 2015. After the surveys were collected, they were stored in a secure location. And once all our data was collected and compiled, we analyzed it using FREQ and Fisher exact tests, and the results will be discussed next by Rick.
My name is Rick Stone. I'll be presenting the results. We had 49 people who were offered the survey and 47 completed it, including 10 males and 37 females. Of those participants, 20 of them received the vaccine, including 50% of the males and 40.54% of the females. The other 27 did not receive the vaccine. 24 reported an income of less than $20,000 per year, and that was the only category where we had a significant number of people. 63% of those people did not get the influenza vaccine. 10 of 17, well, the graph on this presentation shows the rates of vaccination by education level. So there were 17 people who had less than 12th grade education, 13 who were high school graduates, and 11 who had some college. On the left, red and blue, the red and blue bar graph on the left of the image show that 10 of the people with less than 12th grade education got the vaccine compared to, or 10 did not receive the vaccine compared to 7 who did. The middle of the graph shows that 9 of the high school graduates did not receive the vaccine compared to 4 who did. And the far right of the graph shows that 5 of the people with some college did not receive the vaccine, whereas 6 did. So it shows that the most likely to get the vaccine were the people with some college. And lastly, there were 18 people who answered the question of how important, how much of a factor their decision depended on whether they could get the flu from the vaccine. And 10 of the 18 people who answered that question said that the risk of catching the flu from the vaccine was either a somewhat important or the most important reason why they chose not to get the vaccine.
Hi, I'm Pauline, and I'll be going over the discussion for our study. So one of the biggest limitations in our study was access to a large number of participants, as all had established appointments at the clinic. 55% of responders still think that it is possible to get the flu from the flu vaccine, indicating a need for improving education regarding side effects of the vaccine. 63% of participants of lower socioeconomic status did not receive the flu vaccine. This indicates a need to increase outreach by the community health center to enhance flu vaccination rates and understanding regarding benefits of vaccine protection. Also, some limitations, as I said before, include the inaccessibility to the full representation of the Hispanic patient population at the Adelante CHC, and a subsequent small sample size, as surveys were administered to only those present at the CHC to receive a survey. Also, it was only at a select few locations and within a period of December 1st to February 1st. In addition, as this data can only represent the patient population within the Adelante healthcare system, the findings of this study are solely applicable to this population only.
Hello, my name is Kenny Stile, and as part of the conclusion of the presentation, I'll be presenting the conclusions for our project. As the public health role of the community health center here, not only in Arizona but nationwide, is to provide whole person health care, the main point I think is for our research study was really felt it was pertinent to understand which social determinants of health are really associated with patients declining vaccines, at least here and within the community. By examining the social determinants of health, our study helped provide insight into barriers why patients elected whether to receive the vaccine, specifically the influenza vaccination. Our data showed income and education level could potentially influence patients' decisions on the need for an influenza vaccination. Our data also will be shared among the healthcare providers for insight into how best to care for their population in their specific community, not only here in Mesa and within Arizona, but also hopefully can be expanded and presented to other communities nationwide. The future research can also be geared toward other patient demographics and other vaccinations in addition to the influenza vaccination.